Onto your lovely Herald Sun tomorrow. Look, as a AFL footy fan, I'm all over this. Clause for celebration in Catland. Geelong pubs will be open in time for the Cats and Demons preliminary final clash on Friday night, with limited numbers of fans able to gather as restrictions ease in most of regional Victoria. Who doesn't love a bit of Billy Brownless on the front page of the paper, Caleb? Obviously, the announcement that restrictions in regional areas will lift is a welcome reprieve for you poor Victorians suffering with so much lockdown over the past 2 years.
Indeed, and that's Billy there in his pub, the Cremorne at Newtown, just outside of Geelong, or right next to Geelong. But the problem is, though, you know, they're saying, oh, we're coming out of lockdown in regional Victoria, which is great. They'll be able to leave their homes. I mean, that's something, isn't it? But these pubs are only allowed to have 10 people inside and 20 people outside. The Cremorne today was booked out within 5 minutes for Friday night of Andrews making his announcement, and the owner told me that they would be losing money. You know, they're not actually going to make any money when they open up for the prelim on Friday night. They just want to be open. So it's one thing to say lockdown is ending, but it's still not a viable position for business, and that's what they need to get to.
Yeah, it's really terrifying. And the one story that is also being carried across to the Age as well is ready for the worst. The experts are expecting a tenfold increase in hospitalisations, with more than 250 COVID-19 patients expected in intensive care patients by October 16, as the hospital system braces for a surge in cases. There are amongst 800 severe COVID patients forecast to need hospital beds as Victoria's active COVID cases climb to 18,000 over the next 6 weeks. My heart bleeds for you guys, but what makes me really upset is the fact that your health system clearly isn't up to the job.
I mean, it sounds like an extraordinary number, and I've said this many times before. I mean, we've had 18 months to get our heads around this. A rise of coronavirus, a second rise of coronavirus, was hardly a surprise. It shouldn't have been a surprise, but it seems to have taken states by surprise. We should have been prepared for this, but we should take into account that in a month's time, the vaccination rates will be much higher. We'll be hurtling towards 70% fully vaccinated people in Victoria. You might have people being hospitalised, but the number of deaths should start dropping off. And we have to accept that when we open up, we are going to have deaths, and we are going to have people get infected, and we are going to have people going to hospital. The vaccination is not a silver bullet. It just simply makes the situation a little better than it otherwise would have been. We've just got to accept that that's what's going to happen, and we need to have the resources to cope with that. And if we haven't already worked that out, then God help us all.